I know that there are many people who have one leg shorter than another, or in another words, it's PFFD. It leads to very considerable changes of organism. The body load is not distributed naturally, and there are pelvis and backbone curvature and deformation of internal. In this case, we talk not only about cosmetic sense, but also medical help. Do you meet many patients with that problem?
This is most usual problem. I read scientific data with information that 70% of people in the world have legs length difference. Most of them even don't know about that. If the difference is around 1 centimeter, it is almost invisible. But if the difference is more than 1 centimeter, and sometimes it's very large, 5, 10, 15, 20 centimeters, with the Ilizarov technique it is possible to resolve the PFFD problem.
Is it also need to perform a surgery, or there is any another way to resolve a problem?
With large leg difference, there are many stages of treatment, and they depend on femur or tibia contraction. But in any cases, Ilizarov technique could help a patient.
We have possibility to show our audience your clinic and accommodation chambers. Because of long term of treatment, people have feel themselves comfortable. And if they choose to have treatment, they need to see the chambers they will live in. During our talk, I have understood about fantastic results of your technique and high level of comfort for patients during rehabilitation process. I think it have cost a lot. Please tell us who could be a patient.
15 years ago, this treatment could have only a few persons. Nowadays, any person could have a treatment, and only a few of them don't want to do that. Of course, the services for our patients who have rehabilitation in our clinic for months or even half a year have to be very high. I have been in many countries of the world, in Europe, France, Italy, United Kingdom, and also I have been in United States. But their clinics don't have kind of services as we have. Our patients feel themselves like at home. The food for our patients cooked from natural products, so when patients have rehabilitation in our clinics, they feel that it is not standard medical clinic. It is something special. Also, I want to tell that our patients appreciate our clinic and medical services and happy that they have possibility to have treatment.
I know that there are a lot of foreigners that have treatment in your clinic. Do they attracted with cost of treatment comparatively with cost in Europe or USA, or they even couldn't find the clinic where to resolve a problem?
First of all, the price is lower than in European and American clinics. The second, our services and quality of treatment is higher than abroad. That is why many foreigners come in our clinic for treatment. And also the technique that is used in treatment of bow legs and knock-knee correction have no equivalent in the world.
I think if the technique is unique and your clinic is the one clinic in the world where performed successful treatment for bow legs and knock-knee correction, it have to be a lot of attention to your services, and you have many proposals regarding enhancement. As I know, you as a doctor don't need any advertising, because you have so many people who want to have treatment with you, but you couldn't help all people with orthopedic problems around the world. What do you do for as many people as possible to get your help even in Ukraine?
The first steps I have done 10-15 years ago, and right now it isn't easy to create the clinic as I have created. The best way to create clinic is on the base of state clinic, but I have done it in my way. I get many demands from abroad about teaching of my technique, but in private clinic to do is very problematically, because it needs to prepare as a special appointed educational rooms and lecture rooms to teaching young students. Also, I need to attend to students' educational process and select doctors to help me with their studying. At this moment, there are no conditions for me to teach students.
So right now, could you impart your knowledge to someone of young orthopedic surgeons?
Yes, I do that, but it is important to understand that it needs 10 years to study the technique from the beginning till the end.
So the technique is unique, and thanks to Professor Gabriel Ilizarov, who created this technique more than 50 years ago for resolving orthopedic and traumatic problems, it helps people. But why some people turn to clinic abroad, even it costs much for them, and other technique is used? If it's so useful technique, why Ilizarov technique is not widened around the world? And how could you comment this?
The Ilizarov technique widened around the world, but unfortunately not so quickly as it have. I want to tell our audience that studying of Ilizarov technique in United States costs $1,500 per day, just one day. Last year, a professor from Washington came in our clinic 3 times regarding contract for teaching students of my technique. There is a center of studying Ilizarov technique in Baltimore University in United States. The director of it, Professor George Pillay. I have been in his clinic. He studied Ilizarov method in Kurgan. I saw many patients in his center standing in a queue to get treatment. If back in my memories, in times of USSR, people needed to wait for 10-15 years to get the surgery and treatment. So there is high need in orthopedic and traumatic help.
Because of many years to study Ilizarov technique, just a few places to learn it, and necessary high level of professional experience, it is impossible for a lot of people to study it. So there are always many patients who need orthopedic and traumatic help, and only a few professional orthopedic surgeons to help. I think we have to be very happy and appreciate your clinic is located in Ukraine, in Kiev. That so many years works for resolving orthopedic and traumatic problems. At the final of our program, please tell our audience again about the problem you can help with.
First of all, it is trauma, as upper as lower extremities. That may be interarticular joint fracture, multifragmental fracture, double fracture, and other complicated trauma.
Did you miss the cases that after the treatment disablement is gone?
Practically, the Ilizarov technique removes the disablement. All the methods leads to disablement, but Ilizarov technique remove it. So in our clinic we could help with all kind of trauma for children and for adults. And also orthopedic pathology, legs contraction, inborn pathology, healing failure of bones, especially shin bone, osteomyelitis and other problems. Only the Ilizarov technique could completely cure a person with osteomyelitis. Before, the only amputation was used to resolve this problem. Also, I could tell you about term rehabilitation effect. Rehabilitation effect with general medical techniques is 75%. That means that if there are 100 patients, 25 of them is impossible to cure. So they need some more surgeries or became an invalids. The rehabilitation effect of Ilizarov technique is 98%.
Sounds fantastic.
The information is based on data of Worldwide Organization of Health Protection.
Thanks, Dr. Veklich, you find time to tell us about Ilizarov technique, so usual people like me understand your technique. I remind our audience of our guest, Dr. Vitaliy Veklich, the head of Vladistan Clinic, the orthopedic surgeon of high category, Doctor of Medicine. It was a program fifth element. At final, I want to tell that life is very important and no need to spoil it because of own defect. You could find help if you have a wish to find help. Thank you. Goodbye.